Domestic violence in Indian country is really important because the rates are pretty high. It's over 50%, and we need to do something about it. Community coordinated responses is where a number of services come together. For example, social service, schools, it could be law enforcement, providers, emergency department, it could be counseling, it could be a number of programs to come together and to really develop this coalition and work with the program that we fund so that these services are available to those that are in need.
Having nurses that are trained in sexual assault and domestic violence is really helpful here at Cass Lake because people can stay in their own community to seek care. One thing the domestic violence program has done here that I've noticed in my 20 years here, the staff is a lot more comfortable with working with patients that have been had a traumatic event, violence in the home or sexual assault. So the providers are more comfortable, and that makes the patients more comfortable.
Domestic violence and dating violence are not part of our culture. They're not our traditional ways, and neither is it ever okay. Everyone deserves a healthy relationship.